Sickness, violence, fear, anger. Over the past year, many Americans have been exposed to them all. It can all take a toll on your mental health, and there's a name for it. Vicarious trauma. Mandy Gaither has more on how to cope when it all feels too much in today's Health Minute.
From the pandemic to mass shootings and racial injustice, if you're feeling overwhelmed, you're not alone.
Even just us regular people just sitting on a couch listening to these stories are actually having the experience secondary as if they were involved in the trauma.
Cheryl Ziegler, a Denver area therapist, says it's called vicarious trauma and can trigger troubled sleep, increased feelings of depression, heightened anxiety, fears, and anger.
It really is impacting our mental health, but because it didn't happen firsthand, sometimes people aren't connecting that all of this trauma going on around us is actually impacting us to a really significant level.
To cope with all that you're seeing, Ziegler says to identify the source of your feelings and think about your past.
When you have a sense of your own trauma history, you know your vulnerabilities to things that go on around you.
From there, Ziegler says to find ways to reduce stress, like deep breathing. Try to distance yourself from those feelings by exercising and get support from others.
That could be through connecting with others who maybe talk about other things or bring you joy and don't, necessarily bring up these stressors. It could be professional help if you find you're really going through some anxiety or depression.
For many, the past year has been filled with a lot of emotions, so vicarious trauma can be long-lasting, each exposure accumulating inside you. But Ziegler says simply knowing this type of trauma exists, that others experience it too, can help. For Health Minute, I'm Mandy Gaither.